Hello everyone. Today we are going to learn about a new topic in bone pathology, the osteosarcoma. Let's move into the video. We are going to discuss this topic under introduction, classification, pathogenesis, clinical features, morphology, variants, and its treatment. It's the most common primary malignant tumor of bone, and it accounts for approximately 20% of bone cancers, which means 20% of the bone cancers are osteosarcoma. Now coming to the classification, osteosarcoma is classified into medullary osteosarcoma or central osteosarcoma and surface osteosarcoma. Medullary osteosarcoma is further classified into primary osteosarcoma and secondary osteosarcoma. Surface osteosarcoma is classified into parosteal osteosarcoma and periosteal osteosarcoma. Before going detailedly, let's brush up the parts of a long bone. The first comes the proximal epiphysis, then the proximal metaphysis, then comes the diaphysis or the shaft of the bone, then comes the metaphysis or the distal metaphysis, and then the distal epiphysis. Coming to the pathogenesis, the most common reason for these sporadic and germline osteosarcomas are the RB gene mutations, which is nothing but the retinoblastoma gene mutation. Then coming to the TP53 gene mutation in patients with Leigh-Ferroni syndrome. These patients have an increased risk of developing osteosarcoma. Then coming to the inactivation of CDKN2A or INC4A gene, which encodes two tumor suppressor genes. These are P16 and P14. Now coming to the overexpression of MDM2 and CDK4 genes, which inhibits the P53 and RB gene function. These are the guardians of the human genome that restricts the tumor growth in human body. Then according to classification, let's move on to the medullary carcinoma. Their age distribution is bimodal, which means it can occur in people less than 20 years of age and more than 50 years of age. The most commonly occurring age is the less than 20 years of age. It can also occur in older adults. Then coming to the gender, men are most commonly affected than women with a ratio of 1.6:1. Then the most common site of arisal of this tumor is the metaphyseal region of long bones. The order of occurrence of this tumor is the lower femur and upper tibia first, which is the most commonly affected site of this tumor. Then comes the upper humerus. Then comes the pelvis and upper femur. Then comes the jaw bones, vertebrae, and the skull. This is the picture showing the osteosarcoma of the proximal tibia. This diagram shows different bone tumors and their site of arisal. You can see osteosarcoma. It arises from the metaphysis, so it's straight to metaphysis. Now coming to the primary osteosarcoma, this is actually a kind of medullary osteosarcoma. It is the most common osteosarcoma. It occurs in the absence of any underlying disease. Its etiology is still unknown. Its risk factor includes firstly genetic factors, which includes mutation of chromosome 13, because this chromosome 13 contains main genes like RB genes. Their mutation causes high risk of developing osteosarcoma. Then coming to the period of active bone growth, which causes tumors in the younger age, because younger age people have active bone growth. More bone growth causes more chance of developing osteosarcoma. Then coming to environmental influences, if a person is exposed more to radiation and oncogenic viruses, he is having the high risk of developing osteosarcoma. Then secondary osteosarcoma, which is actually a kind of medullary osteosarcoma. Unlike primary osteosarcoma, where there is an absence of any underlying disease, here there exists a pre-existing bone disease like the Paget's disease, infracts of the bone, and the fracture of bone. The behavior will be more aggressive than the primary osteosarcoma. Now coming to the clinical features, osteosarcoma presents with pain and pathological fractures. It consists of a destructive mixed lytic and blastic mass which appears radiologically like a sunburst pattern. This mass breaks through the cortex and lifts the periosteum, which appears as a triangular shadow in the radiological device, which is known as a Codman's triangle. This is a sign of aggressive tumor. This is the radiological image of a bone with osteosarcoma showing the Codman's triangle. you can appreciate the triangular picture over the lifted area. Since osteosarcoma is a malignant tumor, it metastases and spreads to different regions. Its route of spread is hematological route, that is through the blood. Its site of metastasis are the lungs, other bones, and the brain. Now coming to the morphology, osteosarcoma grossly looks like grayish white bulky mass at the metaphysis with areas of hemorrhages and necrotic bone. It has a hard, gritty and mucoid consistency. This image of a bone with osteosarcoma showing the areas of necrosis and areas of hemorrhages. Completing the gross morphology, let's move on to the histology. First, let's see about the sarcoma cells. These are undifferentiated mesenchymal stromal cells. They have marked pleomorphism and polymorphism, that is, they vary in shape and size. They have various shapes such as spindled, round, oval, polygonal, and bizarre tumor giant cells. These bizarre tumor giant cells are multinucleated. They show hyperchromatism and atypical mitosis. Hyperchromatism means thickly stained nucleus, and atypical mitosis is abnormal mitosis. They show positivity for alkaline phosphatase. They have abundant alkaline phosphatase enzyme. In immunohistochemistry, we can detect pimentin, osteocalcin, osteonectin, and type 1 collagen proteins. Here is an image containing group of sarcoma cells. You can see high degree of pleomorphism and polymorphism. The cell varies in shape and size vastly. Here you can see mitotic figures. These are nothing but dividing cells. They show abnormal mitotic cell division. And you can see tumors, giant cells here and there. They have a multinucleated, like 4 to 5 nucleus are present in single cell, and the nucleus here are thickly stained. This is known as hyperchromatism. If we see about the osteogenesis capacity of the sarcoma cells form osteoid matrix and bone cells. The sarcoma cells also may produce cartilage cells and fibrous tissue, or both cartilage and fibrous tissue, which is nothing but the myxoid tissue. Completing the morphology, let's move on to the variants. The first comes the telangiectatic osteosarcoma, next comes the small cell osteosarcoma, and the fibrohistocytic osteosarcoma, anaplastic osteosarcoma, and the well differentiated form. We are not going to discuss deeply into this, and let's move on to the surface osteosarcoma. Surface osteosarcoma. These are slow-growing tumors and these are not aggressive as that of medullary osteosarcoma. They comprise 5% of osteosarcomas and they possess two variants, that is periosteal and parosteal. Now coming to the variants of surface osteosarcoma, first let's see about the parosteal osteosarcoma or the juxtacortical osteosarcoma. They occur in the outer cortex region of the bone. A bone usually consists of an outer cortex and an inner medulla. It occurs in the outer cortical region of the bone. They originate from the metaphysis on the external surface of the bone. They have a better prognosis. Their age distribution is third to fourth decade of the life. They don't have any gender distribution and they occur equally in both genders. Their main site of occurrence is lower end of femur and upper end of humerus. Coming to the morphology of the parosteal osteosarcoma, radiologically they are visible as dense bony mass attached to the outer cortical region of the bone. Grossly they are visible as lobulated and well circumscribed tumor. There will be a calcified mass in the subperiosteal region. Microscopically, these tumors show a high degree of differentiation and there will be a well-formed bony trabeculae. You can see a lobulated calcification in both of these images, which is well circumscribed. Now coming to the next variant of the surface osteosarcoma, the periosteal osteosarcoma. It's a rare occurring osteosarcoma and it occurs between cortex, the outer portion of the bone, and the periosteum, the outermost covering of the bone. This is the periosteum, the outer covering, and this is the cortex. It occurs in the region between this side. And it originates from the diaphysis of the tibia and the femur bones. It is an intermediate grade sarcoma which is neither aggressive and nor slow growing. It occurs in young adults with an average age of 25 years. Microscopically, we can see differentiation of cartilage and high degree of anaplasia. Coming to the predisposing factors of the surface osteosarcoma, its predisposing conditions are similar to that of the medullary osteosarcoma. Its predisposing conditions include Paget's disease, bone infracts, and previous radiation exposure. Now coming to the treatment part, the first comes the neoadjuvant chemotherapy, which is given before surgery so that it will be easy for the surgeons to excise the tumor. Okay, and then surgery is done, and then post-operative adjuvant chemotherapy is done. This is done to prevent recurrence. Okay, the prognosis of this treatment is good. The survival rate, if we come to the survival rate, it is only 5 years. Only it will be only 5 years when there is no metastasis found. Okay. This concludes the topic of osteosarcoma. I have provided notes for this topic in our Telegram channel, medicaldafossa, for which I have provided a link in your description. You can make use of the notes before your exams. Until then, it's bye bye.